Hello, my name is Kendra Collin, and I'm studying to be a psychiatric mental health nurse practitioner. I have been a nurse for over 13 years, with primarily working in a 28-day drug and alcohol rehab unit, also working with patients who have co-occurring psychiatric disorders. I can honestly say when I was growing up and thinking about what I wanted to do with the rest of my life, the thought of being a nurse never crossed my mind. It wasn't until I became a patient that I realized the value of nursing and healthcare. I broke a bone several years ago, and from that experience, with initially going through the emergency department to becoming an inpatient for surgery and having a few days stay at the hospital, I realized how wonderful nurses are, and especially what they do. I didn't know that there was a profession out there where you treat people with such care, kindness, dignity, and respect, with an emphasis for having the privilege to tend to and protect people who are in a state of vulnerability. I have come to fully understand and really appreciate Florence Nightingale's definition of what it means to be a nurse, where she says, "Nature alone cures." What nursing had to do is to put the patient in the best condition for nature to act upon him. For me, that best condition is making sure they feel safe, comfortable, without pain, and giving the best evidence-based treatment so that their bodies are working in the most ideal state to actively maintain optimal conditions necessary for survival. I believe as a nurse moving forward in an advanced practice, it's important to understand what is expected of me and how I treat my patients from a set of ethical principles, starting with how I must realize that my patients will have their own set of values that may be different than mine, where I must honor and respect these differences. I will give them the most current and evidence-based information that pertains to every aspect regarding their health care, so that they can make their own informed decisions. I will try to make sure that there is a mutual trust so that my patients will know that I will have every intention to do them no harm and that all my efforts are for the good of their health. I will strive to make sure that they know that all the information regarding their health stays in confidentiality, and to hope that they can trust that I will honor that privacy. I will ensure that they feel I will not leave their side and will always be a part of their care. I will never judge anyone and let it affect the care that I give them regarding their socioeconomic status, personal beliefs and values, along with the nature of their health disparities. I am someone who needs a lot of structure, where I value and appreciate that there is a set of policies and procedures for nurses in all roles to provide guidance, standardization, and consistency in practices so that my patients, the people that I work with, and myself have this safety net. This is so important to have and understand regarding the new level of responsibility that I will take on as a medical provider. Thankfully, there are laws in place to protect everyone involved in healthcare because it ensures public protection, it promotes access to care, and most importantly, to make sure that every person involved in the medical practice to adhere to the highest of standards. For me to make the decision to be a nurse in healthcare and having the courage to advance my role as a nurse practitioner so that I can help people with disparities regarding their mental health and chemical addiction, it is so important currently to have the specialized care in our society because of the recent rise of the opiate crisis and mental illness. Thank you for watching my presentation and have a good day.